As a parent, what are some of the signs that you should be looking out for if you suspect your child or teen might be cutting or self-harming?
I think that kids are really good at hiding this, first of all, so I would want to make sure that parents know that if they don't see the signs right away, that that's really okay. Some of the signs would be having unexplained cuts or bruises or marks on their skin. And sometimes kids will start to tell stories about their friend's cat, or they, tumbled or they fell somewhere. But if those stories are in excess, if you notice them happening more and more, that could be a concern. Another one would be wearing clothing that's not appropriate for the season. So if they seem to be wearing long sleeves and long pants when it's spring and summer and they should be in short sleeves or tank tops, that could be a concern. Boys will sometimes wear like wrist warmers or wrap things that would be, cool and appropriate, but wrap them around their wrists to try to hide some evidence. I think if they've become more introspective, if they've become quieter, if they're in their room more, in the bathroom for long lengths of time, that is a change. Those could all be risk factors. Obviously, sometimes we don't think about it right away, but if you see things in the bathroom, if you see, more razors than usual, or if you see those disposable razors that have been broken, that would be something to question.
Is it always a solitary practice when somebody self-harms?
I would say that a majority of the time, yes. So this is something that, because even though they're trying to cope, and once the self-harming happens, there is some relief, it is a cycle that eventually then leads to shame. And it's not something that most people are proud about, which is why it's a secret. So though they sometimes may share with their friends that they're doing it, it usually is happening in the bathroom, in their bedroom, somewhere where they are alone.
And does cutting once or self-harming once necessarily mean that you will turn into a habitual cutter, or could be something that maybe somebody sees on the internet, feels like they don't know how to deal with it and tries it, and then doesn't do it again?
Yeah, and I think it could be either. I think that because of the internet and because of the prevalence of the information that's out there on Tumblr, on YouTube, on Facebook, there are websites that tell you how to cut, unfortunately. There are websites that help you not to cut, but we still have both out there, that I think a lot more people may experiment with it. And it probably depends a lot on those initial times trying, what kind of relief they get, whether they're going to continue it, and it's going to be a habit or not. So it definitely doesn't mean that it's going to happen for sure. But if I would tell parents, if they have any concerns, they should have their child talk to a professional to help determine whether it's going to be a long-term issue or has been, or if it's just something that they've tried.